Okay, we have been sent another scan here. This case we're evaluating a site sent in as number 7. In closer inspection on this particular case, I have questions regarding whether that's actually two teeth missing or one tooth missing, whether that's 7 and 6 missing or just number 7. Um, the first thing I'd like to go over in this situation is there appears to be a little bit of movement in the scan, and I noticed that by looking here in the cross-sectional view, we can see what many may consider scatter, but when there's no restoration there, typically we'll see a nice crisp image here. So as we go through this image, we can see some rings of the jawbone and some rings of the adjacent teeth, right, of the teeth. Looks like there may have been a little bit of patient movement here. So from that fact, this scan may not be accurate enough to have a surgical guide fabricated, or CCAT may um, refuse to fabricate a surgical guide. So you may want to just discuss with your team members, A, how to evaluate this to see, and then B, to make sure that the patient does stay still when taking the image to avoid this. So hopefully that helps there. Now, in looking at the site, one of my considerations or concerns that I have regarding this, beyond the implant planning part of it, is the amount of space that we have here. So if we were to simply put a single implant here, we would have a tooth that would be approximately 9.5 millimeters wide, which would be actually wider than the central incisor that we have there. So aesthetically, I begin to get concerned about this particular site aesthetically. Again, will the implant support it? That's another question that we can answer. So my diagnostic assessment in this particular case is that this is probably a great case for some orthodontics, maybe a little bit of stripping between 8 and 9. It'll take a little bit of time with orthodontics, but uprighting the root, bringing those central roots together, closing that V diastema there, especially once you disc these teeth, create the diastema, and then that should give you enough space here to actually have room for number 7 and number 6, kind of like we have on this side. So the closer I look at this, the more I'm pretty confident that this is actually missing two teeth. But again, I've been wrong many times before. Or if it's not missing two teeth, maybe this is number 6 and number 4 or 5 is missing. But aesthetically, I'm concerned about the size of that space right there. This is where having good CEREC data would be helpful diagnostically and aesthetically to determine that. Again, if the patient doesn't mind and the treating dentist doesn't mind, um, that's a different story. So now let's go ahead and take a look at the implant plan. My initial assessment with the implant plan is that it looks pretty good. Um, my first question would be, is we have a pretty wide ridge here, pretty lot of space here. Why would we go with such a small implant? So I would consider going to a larger implant, and this particular dentist chooses to use BioHorizons, a very good implant. So let's see if we can if we can go to the regular 3.8 millimeter implant, and again, that fits. So I wouldn't necessarily use a smaller implant on the number 7 site when this much bone exists. So in terms of the plan itself, again, without more data in terms of where the tooth is going to be and where the gingival margins are, the implant is well in the bone. Maybe there's a little less space here on the buccal than I would like, especially towards the head of the implant. I'd like to see a little more space. The other thing that I look at that I want to point out here is more along the lines of restorability here. And that is going to be here. What I like to do is I like to go ahead and there's my line for my buccal, there's my line for my lingual. So from a restorability perspective, we can't always do this, but I would like my implant head to actually be just lingual or slightly into that incisal edge so that I may perform a screw retain crown. It does make things a little bit easier for us. So what I'm going to do here is while I'm watching this axial view, I'm actually going to tilt the implant. Now notice we're going to probably kill two birds with one stone. One is I don't like the little bit of space that we have right here. I would like to see a little bit more space there. So And the other thing that we would like to do is move this to the lingual. So when I take the head of the implant and move it to the lingual, it's actually going to create more space here and move the implant to the lingual there. So I'll go ahead and move the implant about like so. If I have to, I'll just tilt it back that way a little bit. And now suddenly we're looking at a situation where we can look at doing a screw retained restoration and a screw retained provisional and everything, and give us more buccal plate bone to make sure that we ensure that we minimize our risk of recession and everything. And then the last thing from this view here is we can see here that we have more space right here than we do right here. So we would probably go ahead and just tilt this implant a little bit to the middle there. Again, my bigger concern in this case is aesthetically is that how wide of a space that is to create a lateral incisor there, quote unquote lateral incisor. But other than that, and the slight movement to the lingual there, this plan was very well done and using a bigger implant. Thank you for your case submission, and hopefully you found this very helpful.